any reminder therapy for the appliance correction. Now, what is the problem with a meaningful habit? If there is any deep-rooted psychological problem, you have to go for a parental counseling regarding the psychological aspects of that particular habit. Okay, so remember, meaningful and empty habits, the classification is given by Klein. Compulsive and non-compulsive habit is given by Finn. Useful and harmful habit is given by James. Now we'll deal with the individual habits in detail. So the first habit is thumb sucking. So thumb sucking and oral habits, all these portions you will be already knowing. You can just update yourself. You can just refresh your memories of what you have learned about thumb sucking. Now, moving on to thumb sucking. So thumb sucking is actually considered to be normal during the first 1 to 2 years of life. Now you have two types of sucking habits. You have a nutritive sucking habits and a non-nutritive sucking habits. So as this name says, nutritive sucking habits means the child is actually gaining some nutrition out of that sucking habit, right? That is called a nutritive sucking habits. So under nutritive sucking habits comes breastfeeding and bottle feeding because the child is also getting some form of nourishment. Now, the second type of sucking habit is a non-nutritive sucking habit. Non-nutritive sucking habit means there is no kind of nourishment or anything the child is gaining from the sucking habit. So under the non-nutritive sucking habits comes your thumb sucking, finger sucking, and your pacifier sucking. Okay, so that is nutritive sucking and non-nutritive sucking habit. This is a very important, I've seen MCQs from this portion also. So study this nutritive and non-nutritive sucking habit. Now, Subtelny has classified thumb sucking into 4 types. You have a type A, type B, type C, and type D. So this is the picture of a type A type of Subtelny's thumb sucking classification. This is the most commonly seen type of thumb sucking, Subtelny's type A. So in type A, you just remember this picture. Type A is characterized by the entire digit is actually placed inside the mouth. You can see that the entire thumb is placed inside the mouth and the pad of the thumb is pressing up against the palate. And the thumb is also in contact with your maxillary and mandibular anteriors. Okay, so in type A means the entire thumb is placed into the entire digit is placed into the mouth and it is pressing against the palate and the thumb is also contacting your maxillary and mandibular incisors. Okay, now this is Subtelny's type B. So in type B, what is happening is that thumb is inserted only up to the first joint. It is inserted into the oral cavity only up to the first joint of the thumb and it rests against the palatal surface of the maxillary anteriors and not against the palate. It is not contacting the palate, but it is contacting only the lingual surface of your maxillary anteriors. And also the thumb is contacting both maxillary and mandibular anteriors also. Okay, so this is the picture of a type B kind of Subtelny's classification of thumb sucking. Okay, now we'll see what is a type C and type D. So in type C means a major part of the thumb is inserted within the mouth beyond the first joint. That is a major part of thumb is inserted within the mouth and it rests against the palatal surface of the maxillary anteriors. The lower incisors do not touch the thumb. In type C, the lower incisors are not contacting the thumb. Right? Now, in type D, the thumb is not fully inserted into the mouth. That is only a small portion of the thumb is placed inside the mouth. The lower incisors, but actually contact the thumbnail. Right? So this is Subtelny's classification. Just see the pictures once more. So Subtelny's type A is the most common type of thumb sucking that you see. And this is characterized by what? The entire digit is placed inside the oral cavity and your thumb is pressing against the palate. And you can see that the maxillary and mandibular incisors are contacting your thumb. Now, type B means thumb is inserted within the mouth up to the first joint and it is resting against the lingual surface of your maxillary anteriors and not against the palate. And also you can see that the thumb is contacting both maxillary and mandibular incisors. Now, type C means a major part of thumb is inserted into the mouth. That is beyond the first joint also it is inserted into the mouth, but the lower incisors are not contacting your thumb. Now, type D means the thumb is not fully inserted. That is only a small portion of the thumb is inside the mouth and your lower incisors make contact with at the level of the thumbnail. Okay, so this is about the Subtelny's classification of thumb sucking. Now, about the theories and concepts of thumb sucking, this is a very, very important portion for you. A lot of questions have been asked regarding who put forward which theory regarding this concepts of thumb sucking. So the first one is the classical Freudian theory. Now you tell me which is the theory that was put forward by Freud. Sigmund Freud has put forward which theory? Please use the chat box and tell me. Yes, psychosexual and psychoanalytical theories are the one which is given by Sigmund Freud. So what is actually Freud theory? You know, there were three stages. There were many stages. You have an oral stage, anal stage, phallic stage, latency stage, and genital stage, right? So what is happening in the oral stage? Oral stage means the erogenous zone is within the mouth. That is, whatever the child is getting in hand, he'll put it inside the mouth. So according to this concept of thumb sucking, during the Freudian stages, we know that the area of pleasure is from the oral cavity, and whatever the child gets, the child will put it inside the mouth. So it is because of the oral stage of Freudian theory that the child is resorting to the thumb sucking habit. So that is about the classical Freudian theory in the etiology of thumb sucking. Now, the next theory is given by oral drive theory. This is an important question for you. Who put forward oral drive theory? So the answer is oral drive theory is put forward by Sears and Weiss. So what is actually oral drive theory? According to oral drive theory, it says that the strength of the oral drive that is actually determined by the amount of sucking that the child has undergone, and it is not because of the weaning. So it says that the prolonged nursing, it's not the frustration of weaning, but the prolonged feeding or nursing is responsible for the habit of thumb sucking. Okay, so that is oral drive theory. That is, prolonged nursing is responsible for the for a child to resort to thumb sucking habit. Now, 1 second. Okay, can you see my screen now? You all can see my screen now, right? Fine. Okay. Now the next theory is rooting reflex theory by Benjamin. Do you remember what was a rooting reflex? What was a rooting reflex that we learned in the neonatal reflex? What was rooting reflex? Yes, when the infant's cheek is stroke, the infant will turn the head towards the direction that was stroke. That is referred to as a rooting reflex. So rooting reflex theory in thumb sucking is given by Benjamin. Okay, rooting reflex theory in thumb sucking is given by Benjamin. And according to rooting reflex theory, it says that this rooting and placement reflexes are actually the reflexes that a child that you see commonly in any mammalian infant. So because of that, the child is also reverting to thumb sucking. Okay, so rooting reflex theory is given by Benjamin. Now, next theory or concept is that learning theory given by Davidson. So, according to learning theory by Davidson, it is said that thumb sucking is actually an adaptive response in the child. That is, infant associates sucking with any kind of pleasure, hunger, and all. And finally, if any of this is not gratified, the child will revert to thumb sucking. Okay, that is called learning theory by Davidson. Then you have a sucking reflex given by Ergel. So sucking is actually the first coordinated muscular activity of any infant. So if there is any problems with sucking, that is because of some of the disease in the child or any other factor in which the child is not able to suck properly, what happens is that the child will be dissatisfied, and in that cases, that particular infant will revert to thumb sucking. So that is sucking reflex given by Ergel. So these are the 5 theories, that is theory and concepts associated with thumb sucking. So you have a classical Freudian theory. That means the oral stage of Freud, you know, anything the child gets in hand, will put it inside the mouth. Then you have an oral drive theory. So according to it, it is not the frustration of weaning, but the prolonged nursing that is responsible for thumb sucking. Then you have a rooting reflex theory given by Benjamin. Then you have a learning learning theory given by Davidson. So according to learning theory, it means the sucking is actually an adaptive response, and infant will associate sucking with feelings of pleasure and hunger. So whenever the child feels any hunger or anything like that, the child will revert to, those childs will revert to the habit of thumb sucking. Now, the next concept is sucking reflex given by Erger. So what you need to know in this theory is that which all theory was put forward by which all person, especially oral drive theory, learning theory, everything has been repeatedly asked in various entrance examination. So this is an important slide for you, and you need to know which theory or which concept is associated with which author. Okay, now moving on to the clinical features in thumb sucking. All these things you will be knowing, right? So what you see extraorally in thumb sucking, you see that a reddened, clean, chapped, short fingernails will be seen, or what you call a dishpan thumb. This particular thumb in a thumb sucking child is called a dishpan thumb. And also in chronic suckers, you will see a fibrous, roughened callus on the superior aspect of the finger. So these are the things that you see in the extraoral. Extraorally, these are the features of thumb sucking. Now, next thing is about the lips. So in thumb sucking, you know that there will be incompetent lips, there will be short hypotonic upper lip, and the lower lip will be hyperactive. All this will lead to the further proclination of your upper anteriors. So in the lips, you see incompetent lips, a short hypotonic upper lip, and a hyperactive lower lip. Okay, so that is a feature in the lip. Now we'll see what are the features. All these things you will be knowing. I am not going into detail of all these things. So when a child reverts to thumb sucking, what are the things that you'll see? You'll see that the maxillary incisors are proclined. Then there will be an increased maxillary arch length. Anterior placement of the apical base of the maxilla will be there. A high palatal arch will be there. And since the teeth is proclined, there is an increased chance of trauma to your maxillary incisors. Now, similarly, what are the features that you see in mandible? In mandible, you will be seeing retroclination of your mandibular incisors and retrusion of the mandible. Since there is proclination and apical placement and anterior placement of the base of your maxilla, you see retrusion of mandible and retroclination of your mandibular incisors. And when both of the arches occlude, what are the things that you see? You see an increased overjet, you see an open bite, and a posterior cross bite. Okay, so these are the intraoral features that you see in thumb sucking. Now, when you go for facial form or the profile analysis, what will you see? You'll see a maxillary protrusion, mandibular retrusion, high mandibular plane angle, and a convex profile. Right? All these things are self-explanatory. You can just listen to this. All of you will be probably knowing about all these aspects. Now, in the interarch relationship, what will you see? You'll see an anterior open bite. Why do you see an anterior open bite in thumb sucking? Because thumb actually interfere with the normal eruption of your video. Not clear. You cannot see my PPT. Dr. Alfonso, are you not? You guys, you cannot see my PowerPoint? Dr. Alfonso, it might be due to some internet errors with you. Just check your connection, because other people it is clear. Okay. Now, so anterior open bite. So when both arches occlude, you see anterior open bite. So why do you see actually anterior open bite in thumb sucking? Because the thumb will interfere with the normal eruption of your incisors. And also there will be supra eruption of the posterior teeth. All these things will lead to anterior open bite. Now, the next thing that you see is increased overjet, and you see a posterior crossbite. Now we'll see how a posterior crossbite and all will be coming in the thumb sucking. So what is the reason for the maxillary constriction in thumb sucking? This you need to understand the basic concept, because this is again an important aspect for your entrance examination. So what is happening in the thumb sucking? There is actually an alteration between your cheek pressure and your tongue pressure. So when the thumb is placed between the teeth, what is happening? You can see, you place a thumb in between the teeth, your tongue will be lowered. And because of that, the pressure exerted by the tongue against the lingual surface of the maxillary posterior tooth will be reduced. And at the same time, because during sucking your buccinator muscle contract, the cheek pressure against the teeth will be increased. And two, because of the, even though there is an increased cheek pressure during sucking, there is no counteracting force from the side of the tongue. Because when you place a thumb for sucking, the tongue is lowered, right? All these things will lead to the fact that the cheek pressure will be greatest at the corner of the mouth and will lead to a V-shaped maxilla in thumb sucking. Okay, so what is happening is that there is an alteration in the cheek and tongue pressure. You place the thumb inside, the tongue is lowered, the tongue is not able to, there will be a decreased pressure by the tongue against the lingual surface of the maxillary posterior teeth. And during the time of sucking, your buccinator muscle will be contracting, and that will lead to an extreme cheek pressure against the teeth, and there is no counteracting force given by the tongue. All this will lead to maxillary constriction and lead to a posterior crossbite in the case of thumb sucking, right? Now, moving on to the next thing, that is regarding the treatment of thumb sucking. So to treat thumb sucking, you have various approaches like psychological approach, reminder therapy, and mechanotherapy. Unlike other habits, thumb sucking has got a severe role with the psychological problems. That is, if the child is left alone, or like if the child is not getting proper care from the family, the child might, that might affect the psychological development of the child. And because of some deep-rooted problem, the child will be reverting to thumb sucking. It is unlike your mouth breathing, tongue thrusting, or other habit. The main problem with the thumb sucking is you have to think about the psychological aspect of the habit too. Now, regarding the treatment, you have a psychological approach, reminder therapy, and mechanotherapy. So the first thing is psychological approach, another important MCQ for you. Psychological approach, the first thing that you need to know is you have to go for counseling. That is, whenever there is a thumb sucking, if you feel that the child is having any psychological problem, you have to send the child for counseling along with the parents to see if the child is having some problem in family or some problem with the mother or father that is affecting your child badly. Now, next thing is Dunlop's beta hypothesis, a very important MCQ question for you. So what is actually Dunlop's beta hypothesis? That means that you make the child stand in front of a mirror and you ask the child to forcefully repeat the habit. That is, you ask the child to perform thumb sucking in front of the mirror. So because of the forced purposeful repetition, it will lead to an unpleasant reaction in the child and will lead to abandonment of the habit. Okay, that is referred to as Dunlop's beta hypothesis. That is, forced purposeful repetition of a particular habit will lead to abandonment of the habit. That is Dunlop's beta hypothesis. Very important question for you. Who put forward beta hypothesis or psychological approach in thumb sucking? The answer for that is Dunlop. Now, next thing is about the reminder therapy. So reminder therapy, you will be knowing a lot of intraoral appliances like tongue spice, tongue guards are there. Then fixed appliances like fixed tongue guard, hair rakes, bluegrass appliances. All these are there for the reminder therapy in thumb sucking. So, and also extraorally, in your thumb, you can put a thumb guard pose, something like this. If you place a thumb guard pose like this, they cannot generate vacuum. That is, when the child places the thumb inside the oral cavity, they cannot generate the vacuum, so that sucking will be much less dissatisfying. Okay, it won't be that satisfying if you place a thumb guard pose like this. And also you have a thermoplastic thumb like this, which we used to do during our undergraduate days, right? Taking an impression of your thumb and placing an acrylic cap over the thumb so that the habit will be dissatisfying to the child. Now, the next extraoral approach is regarding long sleeves during night. That is, if you make the child wear a long sleeve, something like this, what will be happening? The child will not able to suck the thumb, right? To get the thumb in hand, he has to raise all the sleeves or everything up. So finally, that will lead to abandonment of the habit. Now, another approach in thumb sucking treatment is chemical treatment. So chemical treatment means what you do is that you actually apply some bitter or sour agents onto the thumb of the child. So when the child places the thumb inside the oral cavity or inside the mouth, that bitter taste will lead to abandonment of the habit. And the agents that we use for chemical treatment include quinine, asafoetida, pepper, castor oil. Okay, so these are the chemical treatment in thumb sucking. Now, next thing is palatal grip. So you'll be knowing about palatal grip. That is, the palatal grip can be fixed or removable. The palatal grips are there. So the main function of a palatal grip is that it breaks the suction force of the digit on the anterior segment and it makes the habit non-pleasurable. So this is the picture of a fixed tongue guard, and this is the picture of a removable tongue guard. You know, you get a lot of picture messages from picture images from Phoneet. So you keep updated about the various appliances. Now, after all this appliance therapy, you'll get a positive change in open bite and overjet within 3 months into treatment, and the self-correction should be achieved by 6th month of the appliance. Following this appliance or reminder therapy, the self-correction usually will be achieved within 6 months of the appliance. And if it is not self-corrected, after the habit like tongue thrusting is controlled, you have to re-evaluate the child for any other habit. So because usually all these dental problems will be corrected within 6 months of wearing of the appliance. And if it is not self-corrected, you have to think about the other possibilities like lip sucking or any other habit which is actually hindering the correction of the particular oral problem. Okay. Now, next appliance is a hay rakes appliance. See, this is another reminder appliance for thumb sucking. What is sometimes you will get regarding your image-based questions. Some appliance you won't be knowing, but sometimes from the options, if you use your common sense, you will be able to answer what type of an appliance is it. See, if you see something like this in the palatal cavity, some projections there, the chance of that appliance used for the correction of thumb sucking and tongue thrusting is really high. Okay, so remember this picture. So you can see a series of fence-like lines are there, right? Fence-like lines are there that will again make your habit non-pleasurable. And this is called a hay rakes appliance. Okay, so this is the picture of a hay rakes appliance, again used for the reminder therapy in both thumb sucking and tongue thrusting. Now, moving on to the next appliance, an important appliance for you that is called the bluegrass appliance. So bluegrass appliance was developed by Haskell. This name you need to know. Bluegrass appliance was developed by Haskell. And what you see is that you can see that the two molars are banded, right? And you see a wire and the Teflon ring is there attached to the wire. So what you do is that you give the appliance to the child and you give instructions to the child to roll the roller instead of sucking the digit. Once you place that, definitely the suction force will be broken and will be gone, and the child will not get that satisfaction of sucking. Moreover, that this will also helps in training your child. That will tongue training or myofunctional exercise is another important aspect of a bluegrass appliance. So if you see something, if you see an appliance like this with a Teflon roller, you keep in mind that is a bluegrass appliance. And the location of the roller is in the most superior aspect of the palate. Okay. Now, bluegrass appliance generally it does not cause any obstruction during eating or during speech, and it is used to manage thumb sucking habit in a child between 7 and 13 years of age. One of the good appliances in the correction of a thumb sucking habit is bluegrass appliance. So keep the picture of bluegrass appliance in your mind. Now, next is a modification of a bluegrass appliance, which is introduced by Chris Baker, which has 4 mm acrylic bead. So main advantage of this Baker's appliance over a bluegrass appliance is that because of the reduced bulk, the Teflon roller will be having a little bit of bulk, right? So because of the reduced bulk and less obstruction, and also because the beads are colorful, they are more attractive to the children. Okay, so that is the modification of a bluegrass appliance. So remember, bluegrass appliance was given by Haskell. The modification was given by Chris Baker, and the advantages and all are self-explanatory. Okay, so keep the picture in mind. Now, next, so that finishes the reminder therapy, and we move on to mechanotherapy. So mechanotherapy, the appliance used is a quad helix appliance. So this is the picture of a quad helix. Quad helix means 4 helices are there, right? So you see 1 helix, 1, 2, 3, and 4 helices are there. So the main function of a quad helix is used for a maxillary expansion as well as for the posterior bite, cross bite correction. Now, when you activate the anterior helices, what will be happening? If you activate the anterior helices, there will be posterior expansion. And if you activate the posterior helices, there will be anterior expansion. Okay, so this is the picture of a quad helix for the mechanotherapy